Recent medical research shows that planning for end-of-life care can improve the quality of life for seniors. This is about more than just health. It's a pivotal step in ensuring peace of mind for both you and your loved ones. Let's explore why considering health directives matters and how it empowers you to maintain control over your personal wishes. Discussing these matters might be tough, but it ensures your values and preferences are respected. Imagine your health information as a puzzle with several intricate pieces. Health directives, including living wills and healthcare proxies, help complete this picture by outlining your medical care preferences. Understanding these terms can feel overwhelming, but think of them as tools that ensure your voice remains a central part of any health decisions. By learning about these options, you ensure that your healthcare aligns closely with your personal beliefs. Recognizing the signs that it's time to discuss health directives is crucial. If you notice ongoing medical concerns or increased doctor visits, it might be time to explore your preferences. Look out for feelings of uncertainty regarding future care. These signs indicate that preparing your healthcare documents can help provide peace of mind and clarity in challenging times, both now and in the future. Ensure your body is fueled with foods that support your health as you plan for the future. Incorporate leafy greens, lean proteins, and whole grains into your meals. These choices can sustain energy and support cognitive function. Consider meals that are easy to prepare and enjoy at any time of the day, making nutrition an integral part of your healthy living plan. Introducing light physical movements into your routine can enhance your quality of life while planning your care directives. Activities like Tai Chi or gardening help maintain mobility and reduce stress. Adjust these exercises to fit your abilities and remember that even small movements can have significant benefits for your overall wellness, helping you stay engaged in life. Regular medical checkups are vital when dealing with end-of-life planning. Trust and open communication with your healthcare provider can ensure your directives are respected. Schedule periodic reviews of your health status and directives with your doctor to make necessary adjustments based on your current needs. Your health team is your partner in keeping your well-being at the forefront of any decisions. It's important to focus on your mental health and social well-being alongside physical preparation. Having conversations with friends and family about your care can relieve stress and strengthen bonds. Engaging in hobbies and staying socially active fosters a positive mindset, which is essential as you navigate the complexities of end-of-life planning with those you love. In summary, preparing for end-of-life care can be a transformative journey. Define your health directives and communicate them with loved ones. Consider starting with a family meeting to share your thoughts and listen to theirs. You hold the power to shape how your future healthcare is managed, providing peace of mind and aligning care with your values.